Usually when we talk about getting a medical diagnosis, there is this, I guess, ingrained expectation of precision. It feels like engineering.
Right, like it should be a simple math equation.
Yeah, exactly. You fall off a bike, you break your arm, the x-ray shows that jagged white line across the bone, and the doctor just points at the screen and says, well, there it is. There is the problem.
It is visible, it is binary. There is a very clear pathway from the injury to the cast and then to the healed bone. We are really conditioned to expect our health to follow a neat, observable storyline.
But then you step out of the emergency room and into the world of chronic illness, and you start searching for answers, and suddenly that x-ray machine is broken.
Oh, completely broken. You are looking at a diagnostic landscape that is incredibly murky.
It is a confusing, often terrifying place, especially when you are the one sitting in the dark at 2 in the morning, right?
Right.
The glow of the screen lighting up your face, and you are just drowning in dozens of open browser tabs.
We have all been there.
Right. You are desperately trying to string together symptoms, test results, and, random anecdotes to figure out what is systematically dismantling your body. If you have ever felt that crushing weight of being completely overwhelmed by the sheer volume of conflicting health information online, you are definitely not alone.
Those 2 a.m. internet searches are, honestly, the absolute definition of diagnostic muddy waters. And the tragic reality is that those muddy waters are precisely where medical misinformation thrives.
It's just people are desperate.
Exactly. When people are in severe, unrelenting pain, and the answers they are getting from their doctors feel, I don't know, insufficient or slow or just profoundly confusing, the internet is always there. It is always waiting with a life raft.
But the problem is that life raft might just be full of holes painted to look like a luxury cruise.
That is a perfect way to put it.
So today we are taking a deep dive into a very specific, highly misunderstood condition that perfectly illustrates this trap. We are exploring the ecosystem that surrounds a disease called chronic pancreatitis.
It is a fascinating and really heavy topic.
It really is. But specifically, we are zeroing in on an internet-famous phrase that you will see plastered across forums, social media groups, and wellness blogs all the time. It is the phrase, how I cured my chronic pancreatitis.
Yeah, that one little 4-letter word.
Cure.
It carries a staggering amount of weight.
It does.
And in the context of this specific structural disease, it is a massive medical minefield.
Yeah.
It fundamentally misrepresents human biology. And honestly, it can lead patients down a path that is not only expensive, but medically dangerous.
So the mission for today's deep dive is to unravel that biology for you. The goal isn't to dismiss hope, because hope is the engine that keeps anyone dealing with a long-term illness moving forward.
Absolutely. You need hope.
But we need to define what chronic pancreatitis actually is on a microscopic level. We need to look at the actual mechanisms of the pancreas to understand why using the word cure in this context is setting a trap.
Right, we are going to separate the hard biological reality of this condition from the highly marketable online miracle claims, which are, so incredibly easy to fall for when you are desperate for relief.
To do that effectively, I think we have to start by looking at the mechanics of the body. Like, we cannot judge the validity of an internet testimonial claiming a miracle cure until we understand the physical machinery that is allegedly being cured.
I agree. Let's start right there with the biology.
Let's look at the anatomy of what I like to call a slow burn. What actually is chronic pancreatitis? I mean, to even approach the disease, we first have to appreciate the organ itself. The pancreas seems like this, hidden superhero in the body.
It really is. It doesn't get the press that the heart or the brain gets, but it is a dual-function powerhouse.
Where exactly is it?
It sits tucked away deep in the abdomen, nestled right behind your stomach and cradled by the first part of your small intestine. And it works 2 entirely different, incredibly complex and vital jobs.
Okay, let's break those down.
Sure. In the medical world, we divide these into the exocrine function and the endocrine function.
I want to make sure we don't get lost in the medical jargon here. So if we look at the exocrine side first, that is essentially a high-power digestion factory, right?
Yes, exactly. The exocrine tissue makes up the vast majority of the pancreas, like about 85% of its mass. It is composed of these tiny clusters of cells called acinar cells.
Acinar cells, got it.
So when you sit down and eat a meal, let's say you have a slice of pizza, your stomach does the initial mechanical churning, but it doesn't really absorb the nutrients.
It just kind of mashes it up.
Right. The real magic happens when that food moves into the small intestine. At that exact moment, your pancreas goes to work. Those acinar cells synthesize and pump out a highly specialized, potent juice filled with digestive enzymes.
And these enzymes are essentially the chemical scissors of the body.
That is a brilliant way to picture it. You have amylase to snip apart complex carbohydrates, protease to break down dense proteins, and lipase to dismantle fats.
So they are actively chopping up the pizza slice.
Yes. The pancreas secretes these enzymes through a network of tiny tubes that merge into a main duct, funneling this potent cocktail directly into the intestines. These enzymes physically break down the pizza into microscopic molecular components.
So that your body can actually absorb the nutrients through the intestinal wall and into your bloodstream.
Exactly. Without this exocrine function, you could eat all day, but the food would just pass right through your digestive tract, completely unabsorbed.
Wow. Okay, so the exocrine side is the chemical scissors for digestion. But then we have this entirely separate system running in the background, the endocrine side.
Yeah, and this is just as vital. Scattered throughout that massive sea of digestion factory tissue are millions of tiny, specialized clusters of cells called the islets of Langerhans.
Islets of Langerhans. Sounds like a fantasy novel location.
It does. But these are the endocrine factories. They don't make digestive juices. They manufacture hormones, most notably insulin and glucagon. And instead of pumping these hormones into the digestive tract, they secrete them directly into the bloodstream.
So wait, while the exocrine side is breaking down the food in your gut, the endocrine side is managing the energy that food produces once it gets into your blood.
Precisely. Insulin acts as the key that unlocks your body's cells, allowing the glucose from your food to enter the cells and be used for energy, which thereby lowers your blood sugar.
And glucagon.
Glucagon does the opposite.
Okay.
It signals the liver to release stored glucose if your blood sugar drops too low.
It's a balancing act.
Exactly. So in a healthy person, this single organ is flawlessly orchestrating both the physical dismantling of your food and the cellular utilization of its energy.
Okay, so we have this dual threat organ, digestion and blood sugar. But the focus today is chronic pancreatitis. Whenever we see the suffix itis in medicine like tonsillitis or appendicitis, it means inflammation, right?
Yes, it implies inflammation.
And the word chronic seems to be the linchpin here, because I think a lot of people might assume chronic pancreatitis is just a regular stomach ache that lasts a really long time. What is happening on a cellular level that actually defines this disease?
That is the most critical question. The defining characteristic of chronic pancreatitis is not just long-lasting inflammation. It is inflammation that initiates a cascade of irreversible structural damage.
Irreversible.
Yes, we are talking about a very specific biological process called fibrosis. Fibrosis is profound, progressive scarring.
Like scar tissue on a cut.
Much worse. The functional working tissue of the pancreas, those delicate acinar cells making enzymes and those complex islets making insulin, are slowly systematically replaced by rigid, non-functioning scar tissue.
I keep thinking about the difference between an acute attack and a chronic condition, because the sources point out that people, and honestly even some primary care doctors, frequently confuse the two. They treat them like they are just different severities of the exact same event.
Differentiating acute from chronic is the foundational step in understanding why the internet cures are so incredibly misleading. The biology of an acute attack is entirely different from the biology of chronic disease.
Let me try an analogy to visualize this. Let's say your pancreas is the bustling kitchen in a high-end restaurant. An episode of acute pancreatitis seems like a sudden, terrifying kitchen fire. Say a grease fire breaks out on the stove.
Okay, I like this.
It is utter chaos. The alarms are blaring, the sprinklers go off, pots are melting. That represents the sudden, agonizing, screaming pain of an acute attack that sends a person to the emergency room.
Yes, the pain is intense and sudden.
But eventually, the fire department arrives, the source of the fire is removed, and the flames are extinguished. The kitchen is a mess, obviously, covered in soot and water damage. The restaurant has to close for a few weeks to clean up, replace the damaged stove, and scrub the walls.
Right, the recovery period.
But after that recovery period, the kitchen is rebuilt, the chefs come back in, the pristine stainless steel is shining, and they are cooking food perfectly again. The organ fully recovers its function.
That captures the essence of acute pancreatitis perfectly. It is a severe, often life-threatening, acute inflammatory event. But the critical biological marker is that once the trigger is removed, Whether it was a gallstone passing or a temporary toxic exposure, the cellular architecture of the pancreas has the capacity to heal.
So the kitchen goes back to normal.
Yes, the organ returns to its normal functional baseline.
But chronic pancreatitis isn't a grease fire that you can put out. It is an entirely different kind of destruction.
It is. It is a fire within the very walls of the kitchen that never truly extinguishes. It is a smoldering, low-grade, relentless burn.
That sounds ominous.
It is. It doesn't trigger the smoke alarms every single day, but week by week, year by year, it systematically destroys the infrastructure. It burns away the functioning ovens, it melts the prep stations, and it replaces them with hardened ash, rubble, and concrete.
Oh.
Yes. That rubble is the fibrosis. It replaces the delicate, functional tissue of the kitchen with thick bands of scar tissue that cannot cook a meal, cannot produce a single drop of digestive enzyme, and cannot synthesize a single molecule of insulin.
That concrete visual really sticks. Actually, I was jotting down another analogy while prepping for this deep dive to really help lock in the reality of this fibrosis process, because it is the key to literally everything else we are going to discuss today. Think of a healthy pancreas, like a soft, highly functional, beautifully porous sea sponge. It is designed to soak up blood and fluid and seamlessly squeeze out vital enzymes and hormones. It is pliable and dynamic.
Soft and porous, exactly.
Now imagine slowly, over the course of years, dipping parts of that soft sponge into a vat of liquid concrete. You pull it out, and the concrete sets and hardens inside the pores of the sponge. Right. Once that concrete cures, you can't just wash it out with soap and water. You can't squeeze it out. The sponge has permanently lost its flexibility, and in those concrete-filled areas, it has completely lost its ability to hold or release any liquid at all.
And if we look at what is happening biologically during fibrosis, your concrete analogy is distressingly accurate.
Really? How so?
Well, in a healthy pancreas, there are specialized cells called pancreatic stellate cells. Normally, they just sit quietly storing vitamin A. But when there is chronic inflammation, these stellate cells become activated. They basically panic.
Yay, panic!
Yeah, they stop storing vitamins and transform into collagen-producing factories. They start pumping out massive amounts of extracellular matrix like collagen and fibronectin, which is essentially biological concrete.
So they are literally cementing the organ shut.
Yes. They lay down this thick, rigid scar tissue indiscriminately, strangling the healthy acinar and islet cells until they die off. The organ literally shrinks, hardens, becomes nodular, and structurally turns to stone.
That is terrifying.
And biologically speaking, human beings do not currently possess the physiological mechanism to turn fibrotic scar tissue back into highly specialized functional tissue. The cells are gone.
So if we are looking at this concrete sponge, the really scary part is that this doesn't happen overnight. It's a slow, progressive hardening.
Yeah.
But what is the spark? I mean, a healthy pancreas doesn't just spontaneously decide to panic and turn itself to stone.
Right, something triggers it.
Something has to initiate that first wave of inflammation and then sustain it long enough for the stellate cells to take over. What triggers this slow burn?
Identifying the trigger takes us into an area filled with a massive amount of misunderstanding. And unfortunately, a deeply entrenched medical and social stigma. When we look at the underlying causes of chronic pancreatitis, we can generally group them into four major categories.
All right, what are?
Heavy alcohol use, genetic factors, recurrent acute pancreatitis, and ductal or plumbing problems.
Let's tackle the one that carries the most baggage right out of the gate, because clearing the air on this is essential for anyone listening who might be dealing with this diagnosis. Let's talk about alcohol use.
Heavy, prolonged alcohol consumption is undeniably a primary trigger for chronic pancreatitis in a significant portion of patients. But we really need to understand the mechanism, not just throw around an accusation.
So what is the mechanism? What does the alcohol actually do?
When you consume alcohol, your body metabolizes the ethanol. In the pancreas, the acinar cells, those digestion factories, metabolize ethanol into highly toxic byproducts, specifically a compound called acetaldehyde, as well as fatty acid ethyl esters.
And those are toxic to the cells.
Highly toxic. These byproducts cause severe oxidative stress inside the cells. They destabilize the delicate membranes that hold the digestive enzymes.
Oh, I see. So the chemical scissors get loose inside the factory.
Yes, exactly. The enzymes activate prematurely while they're still trapped inside the pancreas, instead of waiting until they are safely deposited in the intestines. This leads to autodigestion.
Wait, autodigestion. The organ literally digests itself.
Yes. The pancreas begins to chemically digest its own tissue. Over years of heavy drinking, this constant chemical injury and the resulting inflammatory immune response initiate that smoldering fire. Eventually, it triggers the stellate cells to lay down the concrete fibrosis we just discussed.
Okay, so that is the biological truth. But the reality of this disease, and this is where the frustration really boiled over for so many patients, is that because alcohol is such a well-known trigger, there is an incredibly unfair blanket stigma attached to the diagnosis.
It is a massive problem.
The moment the word pancreatitis is spoken, there is an immediate assumption that paints every single patient with the exact same brush.
The stigma is pervasive, and it is incredibly damaging. It exists in the general public, it exists in emergency rooms, and sadly, it exists among medical professionals who should definitely know better.
Yeah, that is the worst part.
There is this automatic default assumption that if you are suffering from a destroyed pancreas, well, you must have done it to yourself through reckless drinking. And that assumption is not just deeply unfair to the patient's character, it is wildly scientifically inaccurate.
I want to make sure this is crystal clear for you listening. Someone could live what society deems a textbook healthy lifestyle. They eat a balanced diet, they exercise, they don't smoke, they have perhaps only had a handful of drinks in their entire life, or even none at all, and they could still develop this irreversible, organ-destroying disease.
Absolutely. We are learning more about this every single year. Genetic mutations are a massive independent cause of chronic pancreatitis.
Just because of a genetic roll of the dice?
Just genetics. The most famous of these mutations involves a gene called PRSS-MRAN.
What does that gene do?
To understand why this gene is so critical, you have to look at how dangerous these digestive enzymes really are. The pancreas produces an enzyme called trypsin, which is like the master switch that turns on all the other digestive enzymes.
Okay, the master switch.
Normally, the pancreas produces trypsin in an inactive, locked state called trypsinogen. It only unlocks and becomes dangerous once it safely reaches the duodenum, the first part of the small intestine.
That makes sense. Keep it locked up until it's safely out of the organ.
Exactly. But biology is messy, and sometimes a tiny bit of trypsinogen accidentally unlocks prematurely while still inside the pancreas.
Which would start digesting the organ from the inside out, just like we talked about with alcohol.
Right. But a healthy body has a failsafe. It has protective proteins that immediately hunt down and destroy that rogue, prematurely activated trypsin before it can cause a fire.
Oh, that is clever.
It is. But the PRSS1 genetic mutation breaks that failsafe. It alters the shape of the trypsin molecule so that the protective proteins can't bind to it and neutralize it.
So the failsafe doesn't recognize it.
Exactly. So in a patient with this genetic mutation, the master switch gets flipped on inside the pancreas, the failsafes fail, and the organ continuously autodigests. A person with this mutation could be a lifelong teetotaler, a vegan marathon runner, and they could still develop severe fibrotic chronic pancreatitis by the time they are 14 years old.
14. That completely shatters the stigma. It just highlights the sheer randomness and biological unfairness of the disease.
It really is unfair.
But you also mentioned recurrent acute pancreatitis as a cause. I'm thinking back to the kitchen fire analogy.
Let's go back to that.
If I have a grease fire and I put it out, the kitchen recovers. But what if I have a severe grease fire every single month? At some point, the walls are going to be permanently charred, right? Does a history of acute attacks eventually just wear the organ down into a chronic state?
The medical community refers to this as the necrosis-fibrosis sequence, or basically the domino effect.
The domino effect.
Sometimes, a person might have an acute attack with a very clear non-alcoholic cause. Say, a gallstone escapes the gallbladder and temporarily blocks the exit of the pancreas. The pressure builds up, the enzymes activate, a severe acute fire starts, and they end up in the hospital.
But they recover from that.
Yes. The stone passes, the fire is put out, and they recover. But if that person keeps having acute attacks, recurrent acute pancreatitis, the environment of the organ fundamentally changes.
The kitchen is getting tired of rebuilding.
Exactly. The continuous cycle of severe injury, massive immune cell infiltration, and rushed repair eventually breaks the normal healing mechanism. The inflammatory signaling gets stuck in the on position.
The on position, so it never turns off.
Right. The stellate cells get hypersensitized, the dominoes start falling, and instead of cleaning up the debris and laying down healthy tissue, the body starts frantically laying down concrete. The episodic acute events evolve into a permanent chronic condition.
That brings us to the last major culprit you mentioned, ductal problems. This sounds more like an architectural or plumbing issue than a chemical or genetic one.
It is entirely mechanical. The pancreas relies on a main duct, like a central plumbing pipe, to carry all those highly corrosive digestive juices out of the organ and into the safety of the intestines.
Right.
If that pipe gets blocked, the system fails catastrophically.
Why would it get blocked?
This blockage can happen for several reasons. Sometimes calcium stones form within the pancreas itself, much like kidney stones, and they lodge in the duct. Sometimes chronic inflammation causes strictures, which are tight, narrow pinch points in the pipe.
So the tube just gets squeezed shut.
Yeah. There are even congenital abnormalities, like pancreatitis, where a person is simply born with ductwork that doesn't connect properly.
It's like turning on a high-pressure garden hose but keeping your thumb firmly pressed over the nozzle. The water has nowhere to go.
Yes. The fluid backs up into the delicate branches of the organ. The physical pressure alone causes trauma to the acinar cells, causing them to rupture and spill their enzymes.
And there go the chemical scissors again.
Exactly. The pooling fluid creates an environment ripe for chronic inflammation, and the cycle of fibrosis begins. Again, this is a purely mechanical structural anomaly that has absolutely zero correlation with a person's lifestyle choices or habits.
So we have thoroughly dismantled the idea that this is solely a disease of lifestyle. We are looking at a vital central organ that is slowly turning to scar tissue due to complex genetics, mechanical plumbing failures, repeated trauma, or metabolic toxicity.
That sums up.
But understanding how the concrete sets is only half the picture. We need to look at the human cost of this biological failure. What is the physical reality for a patient when this incredibly important dual-function organ systematically shuts down? Let's talk about the fallout of chronic pancreatitis.
The clinical consequences of this disease are profound, and honestly, they touch almost every aspect of a patient's daily life. When we evaluate the fallout, we're generally looking at three devastating pillars:
3 tillers. Okay, what are they?
debilitating pain, severe digestive insufficiency, and the high risk of developing a very complex form of diabetes.
The pain aspect is something that just leaps off the page in the medical literature, and it absolutely dominates the patient forums online. We clearly aren't talking about a mild stomachache after eating a heavy meal.
Not at all. The pain associated with chronic pancreatitis is notoriously severe. It is often described as a burning, boring pain radiating straight through the abdomen to the back.
Boring pain, like a drill.
Yes, like something drilling through you. And what makes it so incredibly difficult to treat is that it's highly complex. In the early stages, the pain is often inflammatory. The swollen, angry tissue is just stretching the capsule of the organ.
Which hurts, naturally.
It does. But as the disease progresses and the fibrosis sets in, the nature of the pain changes. It becomes neuropathic.
Nerve pain.
Yes. The pancreas is deeply embedded in the abdomen, surrounded by a dense, intricate network of nerves called the celiac plexus.
Okay, the celiac plexus.
As the concrete-like scar tissue forms, it doesn't just push the nerves out of the way. It physically wraps around them. It infiltrates the nerve bundles. It damages the myelin sheaths, protecting the nerves.
Oh, wow. So the concrete is choking the nerves.
Exactly.
Okay.
And the immune cells in the fibrotic tissue constantly bathe these nerves in inflammatory cytokines. The nerves become hyperexcitable. They undergo a process called central sensitization, where they start firing constant, severe, agonizing pain signals to the brain, even when there isn't a new acute injury happening.
The alarm system itself is broken and blaring constantly.
The wires are crossed.
So it's like a short circuit in the wiring of your core. That sounds completely exhausting. I mean, living with severe, unyielding neuropathic pain inherently changes a person. It alters your brain chemistry. It shatters your sleep. It causes severe depression.
It destroys your ability to function in daily life.
And typical painkillers, even heavy opioids, often barely scratch the surface of true neuropathic nerve pain, right?
You really won't. It is entirely debilitating. And to compound the sheer exhaustion of living with that pain, patients face the second pillar of the fallout: digestive insufficiency.
Medically known as exocrine pancreatic insufficiency, or EPI.
Right, EPI.
Going back to our earlier discussion of the exocrine function, the factory that manufactures the chemical scissors has burned to the ground.
Exactly. As the fibrosis destroys the acinar cells, enzyme production plummets. When the exocrine function fails, your body physically loses the ability to chemically dismantle the food you eat.
So you could eat a massive meal and get nothing out of it.
A patient can sit down and force themselves to eat a massive 3,000-calorie nutrient-dense meal. But without amylase, protease, and especially lipase to break down the fats, the intestines are locked out. They simply can't access the nutrients.
So where does the food go?
The complex fats and proteins, along with all the vital fat-soluble vitamins like A, D, E, and K, just pass right through the entire digestive tract, completely undigested.
Which means a person could be diligently eating thousands of calories a day and literally be starving to death from the inside out.
Yes. The physical manifestation of this is called steatorrhea. It is frequent, incredibly foul-smelling, oily diarrhea caused by massive amounts of undigested fat passing through the colon.
That sounds miserable.
It is. It leads to severe malnutrition, profound and rapid weight loss, loss of muscle mass, and even osteoporosis due to the lack of vitamin D and calcium absorption.
It is an exhausting, cruel paradox to live with, because eating a meal stimulates the damaged pancreas, causing intense, agonizing pain flares, so patients develop a fear of eating. But even when they endure the pain and force themselves to eat, their body is starving.
It is a terrible cycle.
The medical management for this involves taking synthetic pancreatic enzymes with every meal, right? Pancreatic enzyme replacement therapy.
Yes, PERT is a lifeline. Patients have to swallow handfuls of encapsulated enzymes every time they eat even a snack, trying to manually replicate the precise, perfectly timed chemical release of a healthy pancreas.
That must be exhausting to track.
It is a constant daily mathematical balancing act, and honestly, it is rarely perfectly efficient.
That brings us to the third pillar of the fallout, which involves the endocrine side of the organ, the diabetes risk. And I want to spend some time here because this is a very specific, unique type of diabetes that most people have never even heard of.
Remember the islets of Langerhans? The endocrine factories scattered throughout the pancreas that produce insulin.
Yes, the ones managing blood sugar.
As the fibrosis spreads relentlessly through the organ like a creeping concrete, it eventually engulfs and destroys these delicate islet cells as well. When you systematically lose the cellular machinery required to produce insulin, you develop diabetes.
Right.
In the medical community, this specific etiology is referred to as type 3C diabetes or pancreatogenic diabetes.
Type 3C. This is a crucial distinction. I think when the general public hears the word diabetes, they automatically assume it's type 2. And the management and the biology of type 3C are fundamentally different from the type 2 diabetes we hear about in public health campaigns all the time.
They are entirely different animals.
Let me build on the factory analogy to see if we can highlight the difference. If we look at type 2 diabetes, the factory is still standing. The workers are still producing insulin. But the locks on the body's cells are jammed.
Right, the cells are resisting the insulin.
Yes. The factory manager sees the sugar levels rising, so they scream at the workers to produce even more insulin to try and force the doors open. It's an issue of insulin resistance and overproduction, often tied to metabolic syndrome.
That is exactly what happens in type 2.
But the type 3C diabetes caused by chronic pancreatitis, that is a completely different disaster. The factory hasn't just slowed down, it is burned completely to the ground.
There are no workers left.
Exactly. There is absolutely no insulin being produced because the physical cellular machinery required to synthesize it has been replaced by concrete scar tissue.
The distinction you just drew is vital for patient survival. In type 2, doctors often prescribe oral medications that encourage the pancreas to pump out more insulin, or medications that make the body's cells more sensitive to the insulin that is already there.
But those wouldn't work for type 3C.
In type 3C diabetes, those oral medications are largely useless. There's an absolute deficiency of insulin. The cells are dead. Patients are completely dependent on injecting exogenous insulin to survive.
They have to do the organ's job manually.
Yes. But what makes type 3C particularly volatile, incredibly dangerous, and notoriously difficult to manage, what we call brittle diabetes, is the loss of that other hormone we mentioned earlier, glucagon.
Oh, right. Glucagon is the emergency reserve system. It raises blood sugar if it drops dangerously low.
In chronic pancreatitis, the fibrosis destroys the alpha cells that make glucagon right alongside the beta cells that make insulin. So a type 3C patient loses both the brake and the gas pedal for their blood sugar.
That is terrifying.
They have to inject insulin to bring their blood sugar down, but if they inject even slightly too much, or if they don't absorb their food properly due to their enzyme insufficiency, their blood sugar plummets into severe hypoglycemia.
And without glucagon.
Because they have no glucagon left to trigger a rescue release of glucose from the liver, they can quickly fall into a hypoglycemic coma. They are constantly walking a razor-thin tightrope without a safety net.
When you lay it all out like that, I mean, if you are a patient living with a constant nerve-crushing burning pain in your core, You are quite literally starving and wasting away while eating massive meals. You are swallowing handfuls of enzymes just to digest a cracker, and you are trying to mathematically manage wild, life-threatening swings in blood sugar with a needle.
Mm.
It is an unimaginably heavy physical and psychological burden.
It is a devastating trifecta of suffering that dominates every waking hour.
And looking at that trifecta of suffering, it is completely understandable. In fact, it is the most human, rational response possible that people would scour the furthest corners of the internet looking for a way out. It's no wonder they're searching forums for holistic healing and looking for cures.
Who wouldn't?
Exactly. When conventional medicine sits across from you and offers a lifetime of complex management strategies, enzyme replacements, insulin injections, and pain clinic referrals, a reality that feels entirely overwhelming. An internet post offering a simple, natural cure is incredibly seductive. It feels like a lifeline.
It promises a way out of the nightmare.
But this brings us to the core of our deep dive today. What does the word cure actually mean in the context of a structurally damaged organ? We need to talk about the semantics of hope and why the language we use to describe our health is so critical.
The semantics are everything.
Hmm.
We have to clearly, firmly tackle why the phrase, "I cured my chronic pancreatitis," is medically complicated, biologically impossible at present, and frankly, dangerously misleading.
We need to define the absolute differences between symptom control, clinical remission, long-term disease management, and a true biological cure.
Let's start by defining the gold standard. In strict medical biology, what is the definition of a cure?
Okay, what is it?
A true cure means the complete eradication of the disease process and the complete reversal of its damage. It means the body is fundamentally returned to its pre-disease baseline state.
So like an infection.
Right. If you get strep throat, you have a bacterial infection. You take a course of antibiotics, a chemical kills the invading bacteria, your immune system clears out the debris, the tissue heals perfectly, and the infection is entirely gone. Your throat is exactly the way it was before. You are cured.
Or the broken arm analogy from the intro.
Exactly. If you break your arm, the bone knits back together, the cast comes off, the bone remodels, and you regain full structural integrity. The fracture is cured.
But with chronic pancreatitis, we are dealing with a totally different mechanism. We're dealing with structural fibrosis, the concrete sponge.
Precisely. Because chronic pancreatitis fundamentally involves that pervasive structural fibrosis, the dense collagen-based scarring that replaces functional cells. It cannot currently be reversed.
Concrete is set.
The harsh scientific reality of human biology right now is that we possess no medication, no diet, and no surgical intervention that can turn fibrotic scar tissue back into highly specialized enzyme-producing acinar cells or insulin-producing islet cells.
So a cure is impossible.
Therefore, a cure for chronic pancreatitis is structurally, mechanically impossible. The original factory has been demolished, and we do not have the blueprints to rebuild it in vivo.
So anyone on a YouTube comment section, a Reddit forum, or a wellness blog claiming to have cured their chronic pancreatitis by drinking celery juice or taking a specific supplement is, biologically speaking, incorrect.
Yes, they are misusing the word whether intentionally to sell something or unintentionally out of a misunderstanding of their own condition.
I see.
However, and this is a massive, incredibly important caveat that we must emphasize, symptom control and profound remission are very, very possible. And this is exactly where the wires get crossed online. The distinction between feeling better and being cured gets blurred.
But wait, look at it from the patient's perspective. Put yourself in the shoes of someone who was diagnosed 5 years ago. They were in agony. They completely overhauled their lifestyle. They transitioned to a strict, very low-fat diet. They stopped drinking alcohol entirely. They started practicing stress reduction techniques.
He does everything right.
And they meticulously take their prescribed enzyme replacements with every bite of food. And now, as a result of all that hard work, they are completely pain-free. They are digesting their food, their weight has stabilized, they have energy, and they haven't had a pain flare or a trip to the emergency room in 5 years.
That is an amazing outcome.
It is. Their daily life is back to normal. So why shouldn't they celebrate that as a cure? Why are we splitting hairs over the terminology? Doesn't telling them, well, actually, you aren't cured, your pancreas is still scarred, just feel like doctors being cynical and overly pedantic?
I completely understand why it feels that way, and validating that patients' incredible success is paramount. Getting to that state of being pain-free, stable, and thriving is a massive victory that requires immense discipline. It should absolutely be celebrated. But that state of thriving is what we call remission, or excellent, optimized symptom control. It is successful management. The danger of the word cure, and why drawing this line is not just doctors being pedantic killjoys, lies in the finality that the word implies. A
Final.
cure implies an endpoint. It
Yeah.
implies you have crossed the finish line, the monster is dead, and you no longer have to look over your shoulder.
It creates a false sense of invincibility.
Exactly. If a patient truly believes their chronic pancreatitis is fundamentally cured, human nature dictates they will eventually let their guard down.
They'll slip up.
They might slowly start introducing high-fat meals back into their diet. They might think, I'm cured, my pancreas is regenerated, I don't need to spend hundreds of dollars a month on these pancreatic enzyme replacement pills anymore.
Which would immediately send them right back into the cycle of malabsorption, steatorrhea, and severe malnutrition. It would undo all their hard work.
Yes. Even worse, they might ignore their looming diabetes risk. Even if your pain is perfectly controlled through diet, the underlying scar tissue is still sitting there in the organ, and the slow, quiet destruction of the islet cells might still be creeping forward.
So they still need to be monitored.
The risk of developing type 3C diabetes 5, 10, or 15 years down the line remains incredibly high. You still need your HbA1c checked regularly. Furthermore, chronic pancreatitis carries a significantly increased risk of developing pancreatic cancer over a patient's lifetime.
Oh, I didn't realize that.
Yes. The chronic inflammatory environment can trigger cellular mutations. If you believe you are cured, you might skip your regular oncology screenings or endoscopic ultrasounds. You might ignore a new, subtle symptom because you believe the disease is completely behind you.
Managing the disease means respecting the scarred organ. It means acknowledging the biological reality while optimizing the healthy tissue that still remains. You are successfully keeping the smoldering fire contained in the walls, but you recognize that the fire damage is still there and the electrical wiring is still exposed.
That is the essence of chronic illness management, adapting to the new baseline rather than pretending the old baseline has been magically restored.
Which brings us to the darkest corner of this deep dive. The misuse of the word cure isn't just a matter of semantics or patient psychology. It is a matter of safety, because that single word fuels a massive, highly lucrative online industry of misleading holistic claims. We need to deconstruct these miracle claims.
This is where the muddy waters of the internet become actively predatory.
Predatory is the right word.
When you are newly diagnosed, terrified, in pain, and you search for chronic pancreatitis relief online, you are not immediately met with nuanced discussions of exocrine insufficiency.
No, you are hit with an avalanche of claims regarding holistic healing, diet-only cures, unregulated miracle supplements, and influencers monetizing their personal health stories.
It is a barrage of misinformation.
Let's explore why these claims are so prevalent and, honestly, why they're so intensely persuasive to you when you are desperately looking for answers. Let's start with diet, because here's the incredibly tricky part that makes debunking these claims so difficult. Diet is actually a massive foundational part of managing this disease.
That is the tricky part. The online gurus aren't pulling it completely out of thin air.
Right.
Diet is arguably the cornerstone of non-surgical management. A strictly low-fat diet, absolutely zero alcohol consumption, eating small, frequent meals rather than large, heavy ones. These are vital, medically sound, universally prescribed pathways to symptom control.
Right. So an online influencer gets on YouTube and says, I was diagnosed with severe chronic pancreatitis. The doctors told me I would be in pain forever. But I changed my diet to this specific raw vegan, ultra low-fat regimen, and I cured my chronic pancreatitis. Buy my meal plan to learn how.
And people buy it.
They are halfway telling the truth. The diet absolutely helped them. But the danger and the deception is in how they frame the mechanism of that relief.
The expert medical consensus entirely agrees that changing your diet is crucial. But we must clearly define the mechanism of action. Changing your diet to a low-fat regimen manages the symptoms by drastically reducing the workload on the pancreas.
Gives it a break.
Exactly. When you eat a heavy, fatty meal, your intestines send a massive chemical signal to the pancreas, demanding a huge surge of lipase enzymes. The damaged fibrotic organ strains to produce it, triggering pressure, inflammation, and immense pain.
Because it's pushing against the concrete.
Yes. When you eat a small, low-fat meal, that demand signal is very quiet. The pancreas barely has to work. It rests the organ. But, and this is the crucial distinction, resting the organ does not cure the underlying fibrosis.
It doesn't dissolve the concrete.
It does not dissolve the concrete. It just stops irritating it.
Let me use another analogy. It is exactly like having a fractured ankle. If you sit on the couch and completely stop walking on it, The pain subsides dramatically. You feel better.
You feel great, as long as you're sitting.
Right. But the bone is still broken. Sitting on the couch didn't instantly fuse the bone back together. It just removed the mechanical stress from the injury.
That is a perfect parallel. The low-fat diet removes the chemical stress from the injured pancreas, but the online miracle claims take that entirely valid, medically sound concept of symptom relief through organ rest, and they repackage it as a miraculous cellular reversal.
They conflate feeling better with being cured.
And that conflation is the gateway drug to the next tier of the online grift, the supplements.
Oh, the supplements. This is the wild west of the internet health sphere. The sheer volume of pills, powders, and tinctures marketed specifically to desperate patients is staggering.
It truly is an unregulated minefield.
What do they typically claim?
You will see endless advertisements for proprietary herbal blends claiming to regenerate pancreatic tissue or detoxify scar tissue or cleanse the pancreatic ducts. They promise a complete holistic cure.
And are any of them legitimate?
I need to be remarkably clear and unequivocal for anyone listening. These claims are biologically unfounded. There is no herbal supplement on Earth that dissolves dense collagen fibrosis in the pancreas.
I think the natural question anyone would ask is, why do people swear by them so fervently? You can pull up one of these supplements and see hundreds of 5-star reviews saying, this supplement saved my life, the pain is completely gone, my doctor was wrong. Are all those people just lying? Are they fake reviews?
While some might be fabricated, most of those patients are likely telling the absolute truth about feeling better.
So they are feeling better, but not because of the pill.
We have to look critically at why they feel better, and it rarely has anything to do with the active ingredients in the unregulated pill. First, we have to acknowledge the placebo effect.
The power of the mind.
The placebo effect is not a myth. It is an incredibly powerful, deeply neurological phenomenon, especially when it comes to the perception of pain.
Because you expect to feel better.
Yes. If you are desperate and you spend $100 on a beautiful bottle of supplements that you truly believe will heal you, your brain's expectation of relief can trigger the release of endogenous opioids, your body's natural painkillers.
Wow, so your brain actually numbs the pain itself.
Exactly. The subjective perception of the nerve pain genuinely decreases. But even more significantly than the placebo effect, we have to look at the natural history of the disease itself. Chronic pancreatitis is rarely a constant flat line of agony.
It comes in waves.
It is characterized by the natural waxing and waning of symptoms.
Like the smoldering fire flaring up when the wind blows and then naturally dying down to embers again. It is an episodic disease.
Precisely. A patient might enter a terrible weeks-long pain flare due to a minor dietary indiscretion, stress, or just the random biological fluctuations of the inflammation. They are in agony.
And that is when they start Googling.
Out of sheer desperation, they order an expensive pancreas regeneration supplement they saw on Instagram. Because shipping takes a few days, they start taking the pills right around the exact time that the inflammatory flare was naturally peaking and beginning to subside on its own.
The timing lines up perfectly.
A few days later, the pain fades as the organ naturally returns to its baseline smolder.
And the patient, completely understandably, links the two events. They naturally attribute the sudden relief to the new supplement they just started taking, rather than to the invisible natural cycle of the disease running its course.
Correlation is mistaken for causation. It is a fundamental human cognitive bias. We see patterns.
And this exact cognitive bias is how the opportunistic corners of the wellness industry monetize the desperation of chronic illness patients. They sell it a bottle of crushed herbs during your absolute lowest, most desperate moment. And when your body naturally, inevitably enters a temporary period of remission, they take the credit.
They capture your loyalty, they secure a glowing testimonial, and they sell you a lifetime subscription to a useless powder.
It sounds like these online miracle claims are doing something incredibly insidious. They are taking a very real, medically sound practice like dietary management, organ rest, or even just the natural relief of a cyclical flare-up subsiding, and they are hijacking it.
That is exactly what they're doing.
They slap a shiny, capitalized CRE label on an empty promise to sell you an unproven, expensive fantasy. Looking at it through this lens reinforces why it is so critically important for you, the listener, to trust validated, biologically sound medical pathways over flashy, emotionally manipulative internet testimonials.
Trusting the science is key.
The honest medical pathway says this is a permanent structural injury. The road ahead is hard. But we have tools to help you manage this. We can aggressively control the nerve pain, we can replace the missing enzymes so you stop starving, and we can manage your blood sugar. We can help you find a new, stable baseline.
Which is a very hopeful message in its own right.
It is. The internet, on the other hand, says doctors are lying to you. Buy my $50 PDF and my proprietary enzyme blend and erase the disease entirely. One pathway is honest about the biology and offers real, sustainable management. The other is selling a physiological impossibility wrapped in the language of empowerment.
It is the ultimate exploitation of hope. And as we established at the very beginning of this conversation, hope is a vital survival mechanism for anyone navigating chronic illness.
But it has to be grounded.
Right. Hope that is anchored in falsehood, pseudoscience, and physiological impossibilities eventually leads to crushing disappointment, financial drain, or devastating medical harm when the disease inevitably progresses unchecked.
We have covered a massive amount of dense, difficult ground today. We started by looking closely at the intricate anatomy of the pancreas, that hidden superhero organ running both the exocrine digestion factory, producing those chemical scissors, and the endocrine factory, carefully managing our blood sugar with insulin and glucagon.
It is an incredible organ.
We redefined what chronic pancreatitis actually means. We learned it is not a sudden, temporary kitchen fire that can be extinguished and cleaned up. It is a slow, relentless, smoldering burn that literally alters the cellular architecture.
It initiates that fibrosis.
Right. It activates those stellate cells, causing them to panic and replace the functional soft sponge of the organ with inflexible, permanent, concrete scar tissue.
We also took the time to unmask the real culprits behind this disease. We aggressively dismantled the pervasive and unfair stigma that this is simply an alcohol-induced condition.
That was a huge takeaway for me.
We explored how microscopic genetic mutations like PRSS1, mechanical plumbing issues in the ducts, and the domino effect of recurrent acute attacks can initiate that irreversible, concrete scarring in absolutely anyone, regardless of their lifestyle.
We looked unblinkingly at the devastating fallout of that fibrosis. We discussed the exhaustion of severe neuropathic central nerve pain, the cruel paradox of starvation from exocrine digestive insufficiency, and the incredibly volatile, dangerous reality of type 3C diabetes,
Where the insulin factory had burned entirely to the ground, taking the glucagon safety net with it.
And most importantly, we navigated the semantics of hope. We firmly established that because the structural damage of dense collagen fibrosis is, with our current medical technology, permanent, making a true biological cure impossible right now.
But we also celebrated the alternative.
Yes, the fact that incredible symptom control, deep clinical remission, and highly effective long-term management are entirely within reach for patients who commit to the necessary lifestyle and medical adjustments.
That is the core empowering message that needs to cut through the internet noise. Profound remission is possible. Reclaiming a high quality of life is absolutely possible.
But it requires respecting the reality of the structural damage. It requires working with the scarred organ, not buying into the fantasy that the scars have magically vanished.
Exactly.
So for you, the listener, whether you are dealing with this specific condition, a different chronic illness, or just trying to navigate the overwhelming sea of health information online, understanding this crucial difference is your best defense. You have to arm yourself with the knowledge of the difference between reversing structural damage and successfully managing symptoms.
It will protect you from so much heartache.
The next time you see someone online passionately claiming they cured their chronic structural disease, stop and look closer. Look at the biology. Are they actually claiming to have reverse dense scar tissue with a smoothie? Or are they simply successfully managing their symptoms through diligent diet, lifestyle changes, and perhaps a lucky break in the natural cycle of their disease?
Hope is one of the most powerful tools in medicine, but it must be anchored in biological reality, not internet marketing.
And if we bravely accept that reality, if we acknowledge that a scarred, fibrotic pancreas cannot currently be cured by reversing the tissue damage with a specialized diet or a proprietary herbal supplement, it actually shifts our perspective toward the true, exciting future of real medicine.
It does. It raises an incredibly important, provocative question to leave you with today.
What is it?
What if the future of treating chronic structural diseases like this lies not in endlessly chasing a magic biological eraser for scar tissue, but in the rapidly emerging hard science fields of regenerative medicine?
Oh, like building a new one.
Exactly. If we truly cannot fix the original burned-down factory, How close are we to building a synthetic replacement using bioartificial organs or utilizing targeted stem cell therapies to seed entirely new functional islet cells into the liver? The true cure might not be repairing the concrete sponge, but replacing it entirely.
Now that is a deep dive for another day. But until then, the next time you find yourself staring at an internet page at 2 in the morning that promises a miraculous, easy fix to a complex medical problem, remember the concrete sponge. Ask yourself if they are offering a real, biologically sound strategy to help you live with it, or if they are just trying to sell you a very expensive washcloth. Keep questioning the claims, keep learning the biology, and always trust the science.